Hello, to you today from Nova Pediatrics, and I'm pediatrician Tiffany Meyer,
And I am Beth Boswick, a family nurse practitioner.
and we're coming to you today to discuss some important topics. First, we're going to do a brief discussion about COVID and the flu and how they look similar and how they're different. And then we're going to try to give you some recommendations and some helpful tips about how to deal with Halloween and your children. Um, and um, and of course, we are still giving out flu vaccine. So if your child has not received his or her flu vaccine, please schedule an appointment. And we do have flu vaccine available. So we're going to start first discussing a little bit about, and we're going to maintain our 6 feet of distance, so we're going to remove our masks. And so COVID and the flu. So obviously there's been talk and some concerns about, are we going to have two pandemics going on, a flu and a COVID for the fall? And so how are they the same? So of course both are contagious, right? It has been determined that coronavirus is likely much more contagious, 50 to 100 times more contagious than the flu. Um, and both of them are probably going to be circulating this fall and winter. Some of the similarities between the two are kind of obvious, but the fever and the cough and the runny nose and the sore throat and the some headaches and vomiting, diarrhea. But the one big difference typically is that coronavirus folks, not everyone, but if they have this, it's pretty symptomatic, it's pretty definitive for corona, is the loss of your smell or your taste or taste. Could be one or could be the other or both. Um, and so anything you wanted to add about the symptoms?
No,
Okay.
I think that's why it's so important to talk about it because the between the flu and the coronavirus, we do have very similar symptoms, but it leads us to talk about the flu shot and why it is so important this year. So obviously we have a flu vaccine that's helping us to protect ourselves and to prevent the flu, at least lessen the symptoms of the flu and decrease the length of symptoms, which is going to help us stay healthier. It also, during this time with COVID in our area and with flu to possibly come soon, we are wanting to get everyone vaccinated to decrease the effectiveness or the strain on our healthcare systems.
That's
is the
right.
biggest positivity that we can take away from getting your flu vaccine.
And the good news is we clearly have a flu vaccine, right? We don't have a COVID vaccine available yet. And so, but we do have the flu vaccine. So please try to get yourselves and your children vaccinated this fall. We do flu vaccine all the way through even January many times. So,
Yes.
but the earlier you do it, in the sense you want to get it in before flu's really circulating in the community, the better. So, by October, November is definitely good to get your flu vaccine. Um, the one other thing I wanted to bring up, a difference between the flu and the COVID virus. Flu symptoms typically, once you're exposed, you usually get your symptoms within 1 to 4 days. The difference is that for this COVID virus, once you're exposed, your symptoms usually appear as early as 2 days, but maybe up to 14 days. So you've got this longer time period to develop these symptoms. So usually once you're exposed to the flu, you're going to know if you're going to get it pretty soon. But the COVID vaccine, that's why people, or COVID virus, excuse me, that's why people are in quarantine for so long, because you really could develop symptoms 2 weeks out from the time you were exposed. So difference in that sense. And then, so, Beth, did you want to talk to us a little bit about how children fared last year from the flu?
Last year, 188 children under the age of 19 died from complications from the flu, according to the CDC. And about typically 80% of children who die from the flu were not vaccinated. And that's why any child 6 months of age or older should be vaccinated to help limit those deaths and those complications.
That's another good reason for the flu vaccine, obviously, because we do know that it is protective. It may not be 100% protective, but it really does lessen the flu if you were to get the flu. Um, and just to kind of reiterate this, children with certain medical conditions like heart or lung problems or diabetes or overweight or sickle cell disease, they can be at more risk for complications, severe complications for flu and the coronavirus. And so those children really need to get their flu vaccine. And the last thing we wanted to say, and Beth, you want to finish it up, is where to get our flu vaccine.
At any of your our pediatrician office does offer them. It's the best place to get it. We're equipped with knowing all about children and how to handle it. And your child can get other vaccines as well in combination with your flu vaccine. So if you're due for your well visit, don't delay on your well visits. Please make your well visits. Stay on top of your vaccines. And we can also vaccinate for the flu as well in the next month or two for sure. You're definitely protecting yourself from the flu and also from other of the viruses and illnesses that we protect against.
And a last thing, there have been studies shown that, folks are avoiding going for their physicals. And so, in children in particular, we worry that they're going to fall behind in their vaccines, and other infectious diseases that we haven't seen in many years are going to start resurfacing. So please don't worry when you come into our office. We're taking every precaution. All of us are wearing masks when they're in the room. We're wearing our gloves. We're screening at the door. We are taking temperatures. We are doing all our precautions. We're cleaning exam rooms in between every patient. And so we are doing our part to try to make you feel safe. So please don't delay in your annual physicals.
There was a question that was sent to us prior to us doing this live video that pertained to specifically the immunocompromised child and the effects of the coronavirus or the COVID-19 with an immunocompromised child.
Right.
And the literature that out there, and you can support this, Dr. Meyer, but it really is inconclusive, right? We don't know a lot still at this time, but all we can say is that you need to be extra cautious, more stringent on your precautions in hand washing, limiting your exposure to large groups of people, limiting your exposure to the general public. And clearly, if you're, as hard as it might be, if you're a parent of a child that is immunocompromised, really doing your best to stay away from them if you do have any symptoms. It can be very hard, and but that's the recommendations that they have given.
That's right. And unfortunately, we really don't have all the information and the data in yet. We're only 7 months into this. And so we don't really know exactly how immunocompromised children fare, particularly with COVID virus. And then flu, we know that they typically, flu is not good for them, and it can make them pretty sick. So that's another reason for them to get the flu vaccine. But I would say that, as Beth said, just good hand washing, wearing masks, keeping yourselves isolated as much as you can. Obviously, trying to go out and enjoy the weather if you're outside, and distancing, you should be fine. But yes, you want to take all precautions. So, and that leads us into talking about Halloween. So, and we're going to try to give you some ideas of low risk, moderate risk, and high risk activities by the end. So, Halloween, of course, this year, sadly enough, is probably going to look a lot different than other Halloweens. But you can still do some fun Halloween activities. And really, it's kind of your take on it, your perspective. If you go into saying, okay, we're still going to have a fun Halloween, it's just going to be a little different, I think your children are going to pick up on that energy, and they're going to enjoy it too. So obviously, still choosing your costumes, decorating your pumpkins, getting those special treats together, you still want to do things like that, but you're just going to have to do things in a little different way. It may be more family time together, more family activities versus bigger group activities. But you really do want to avoid those large gatherings, and you still want to try to maintain 6 feet of distance, including wearing a face covering. And so, just even if you have a face covering on, you want to still maintain your distance. I mean, there are times sometimes when you can't perfectly maintain distance in a face covering, but still try to do both. And then, of course, washing hands often. And Beth is going to start us off with some ideas of how to do some fun Halloween activities.
So how about a virtual costume party and parades? So we can do, all the children love to pick out their costumes, and they think about this months in advance and what they're going to be for Halloween. Don't say that we can't do anything for that. Right. You can have video chats and video parties online to let the kids show off their costumes and play games between friends and family members. Grandparents, I'm sure, will want to be involved in that to see them, their grandchildren. Outdoor costume parades are fun as long as you can maintain your distance. Neighborhoods can come together for those types of events, and that would be you could even just do a simple postcard in your close neighborhood, and you could have the kids help you, tape them to the mailbox. That maybe we can all meet socially distanced to have a parade. It'd be kind of fun. Making sure that you're obviously that. And keeping in mind that your costume mask is not necessarily a protective piece of equipment. That most of those masks are obviously for child's play. So you want to make sure that you are definitely wearing a face covering that fits snugly around your nose and mouth. And if you are, wanting to use they have cautioned against using paints. Some of those paints can be toxic if you choose to paint your mask.
That's right. You don't want your child to have to smell those fumes from the paint. Another fun Halloween activity could be a spooky movie night. So you can celebrate with a movie night and dress up as your favorite characters. Do this as a family, or consider letting your friends, even your children, watch with friends online though while they're video chatting. So maybe each and the friend can be watching the movie at the same time, but they're in their own houses and they can video chat, and you can start the movie at the same time. So there's different ways. It's being creative. Obviously, may not be the ideal way, but there are ways to kind of still have fun.
Decorating pumpkins, always a hit with most children and even adults. Love decorating pumpkins. You can do the traditional way of cutting out. Once your child has made their design, they can ask an adult to help cut out those designs, but obviously keeping in mind being careful to avoid any pumpkin carving injuries, yes. Taking those safety precautions into play. Obviously, you could also use paint. You can paint your pumpkin Absolutely. As well. That doesn't have to be a carving. And if you do carve, you can consider putting an LED light rather than an open flame candle in your pumpkin. And also the seeds are a nice snack after roasting.
Yep.
It's nice and fun.
Yep. And Michael's has the foam pumpkins and the plastic pumpkins, so you can also decorate those, and you don't necessarily have to get a real pumpkin. So Halloween themed treats. These are all kind of just different ideas, and you may even come up with even better ones. But you can decorate a pizza with toppings in the shape of a jack-o'-lantern. You can make tangerine pumpkins and peel the tangerine and stick a thin slice of celery on top to look like a stem. So all these kind of different things, and obviously the younger kids are going to enjoy this, right? But maybe some of your older kids may think it's fun. Maybe they're the ones who can create this for the younger kids. As always, being pediatricians, we're going to tell you to remember about choking hazards, right? So particularly if your child's under 3 or even 4, just make sure that that you're not giving them, the whole grapes, or you're cutting things small. You don't want them to be choking on pieces or chunks of food. So.
Stay connected to your community because they probably have possibly some outdoor events that might be going on, including at the parks and the arboretums and zoos. There might be some outdoor venues that in your area that might be doing socially distanced type of activities. So staying aware of that, staying away from crowds and clustering, obviously, but just keeping in touch. Sometimes I think with COVID we're not as connected to our communities, but finding out what's going on. Avoiding your open haunted houses are probably not a great choice. And you could but you could do a corn maze if it's available. Being obviously outside would be probably helpful. If you're going to be doing, they don't recommend hay rides. I think was also on the list of not a good choice. In any type of activity that might include screaming. Obviously, screaming increases your risk of spreading the respiratory virus. So if you can limit the screaming and scares, that probably would be best. And obviously, if you're going to any pumpkin patch or apple orchards, using hand sanitizer before touching anything is probably best as well.
And so that does mean, though, you can still do some of these activities, but you're spacing out, like pumpkin patches, apple orchards. You just maintain your distance, and you can still do some fun fall activities.
Yep.
Some general safety tips. If your children are going to be outside, remember, especially if they're outside after dark, marking their costumes with reflective tape so you can find them, so other cars can find them, other people, so they aren't, obviously we don't want them hit by cars. Remind them to be careful because drivers of cars may not see them. They should wear good shoes, no flip-flop sandals if they're out walking around. And their costumes need to be short enough. You don't want an oversized costume that's dragging and they trip over it. So just some common sense stuff, but just something to keep in mind. And what about, and Beth's going to tell us about some trick-or-treating options.
Trick-or-treating, obviously, I think it's probably been talked about maybe in your community if you are staying in touch. Some neighborhoods are discouraging it or even canceling it this year, which is understandable. But a family scavenger hunt for treats in your home or yard can be a fun alternative. I also know a family across my street that had a party where someone hid behind each door in their home, and the kids all went from door to door in their home, and they had family over, and they did trick-or-treating to each door. And trick-or-treating, if it is still on in your neighborhood, obviously clustering at doorsteps or anywhere else is not advised. We should probably avoid the large groups or clusterings.
Right, and maintain distance, right? You're maintaining distance.
Exactly.
And some other things, and if you haven't heard of this, many people have, but the booing. So you can socially distance and safely boo someone, meaning you come up with a little goodie bag. It doesn't have to be big, and you drop it at somebody's door, and you ring a bell and leave. And so that's a nice way to kind of do some fun Halloween stuff too.
Yes, and keep your friends included.
Exactly.
If you are handing out treats, consider putting them in outside on like the light to line your yard, or to or individually pack your treats and put them out so the child can take it. There also is this PVC pipe chute, this candy chute. I know a family that's doing that this year too. And obviously the non-edible treats are a good option as well, especially for those with food allergies, which we'll talk about more
in a bit. So just one more thing. The news did a program a week or so ago about a child who came up with his own PVC pipe candy shooter. And what that really is, it's a long pipe. You're at least 6 feet away, and you put the treat in the one end, and then someone can catch it at the other, and that's completely socially distancing. It's a fun activity for kids to do. So just being creative with ways you can still trick or treat. How much? So there's a question about how much touching objects spreads coronavirus. Isn't really clear. We're pretty sure that the respiratory component is the biggest part of it, but you still really want to be careful with touching a lot of stuff. So if your child collects treats from a few socially distanced neighbors, you're probably going to want to wipe down the packages, or maybe let them sit for a couple days and before giving them out. And I know that's going to be hard. Your child's collecting candy. They want to jump at it. But maybe a better option is if you buy a little candy for them, and then you can give out from your stash, and they can get to the other stash, a few days later. Obviously, as we said, good hand hygiene before and after. Trick-or-treating is always a good idea. So, consider offering non-edible goodies, right? So there's all these other options. Kids with food allergy, obviously, Halloween is so tricky and so difficult, especially those poor kids with peanut and tree nut allergies. So it can be very difficult. There's this project called the Teal Pumpkin Project. If you Google that, you can find out about it. And it's put on by the Food Allergy Research and Education Department, and they want to promote safe trick-or-treating and trick-or-treating options that may be food related or okay for kids with food allergies. Again, make sure the items are not a choking hazard, right? So we want to just briefly go over some lower, medium, and higher risk activities, and we sort of said them before, but we're going to categorize them for you just so you know. Some of the lower risk activities, as we said, carving or decorating pumpkins with members of your family and displaying them, that's completely a safe thing to do. Carving or decorating pumpkins at a safe distance from neighbors, like in a driveway or in a parking lot or somewhere where you can socially distance, is another good way to get together with folks, but not being too close. Decorating your house, right, or where you live, your space, your apartment, wherever you live, decorating that is a great thing you can do. Doing a Halloween scavenger hunt, as Beth said, in your house, right, or where children are given a list of Halloween themed things, and then they got to walk either outdoors or they can do it indoors, obviously weather permitting. We've had some nice days recently, so hopefully we can take advantage of the weather. And then having a virtual Halloween costume contest, right? You can Zoom your family and friends and do a costume contest that way. And then the movie night, you can do that with your family. You can even Zoom a friend and do it with them. And having that scavenger hunt trick or treat search, even so you can do items or you can do candy or both, is obviously all these things are good, safe things that you're not even really putting yourself at risk, if at all.
Right.
For Halloween.
For Halloween. Moderately risked activities, like I said, we've kind of gone over these, but it is a moderate risk to do these things. But yeah, the one-way trick-or-treating where you have the treats laid out, you are still coming in contact with something that someone has touched. So obviously if you're making these kind of goodie bags or these individually wrapped items, make sure you're washing your hands prior to putting these items in the bags, and wanting to maintain social distance while these children are grabbing these treats to go. And the parades even is a moderate risk if you wanted to do it in a small group. So maintaining your social distance is very important. But you are outside, so that is a good thing. And so still moderate risk though. Also, obviously attending a costume party held outdoors where everyone can be 6 feet apart, maintaining that social distance. Yeah, and remembering that the masks are not, or at least the Halloween costume masks are not sufficient to protect you. And obviously also do not wear a costume mask over a protective cloth mask. And it could be dangerous if the costume mask makes it hard to breathe. But instead using maybe a Halloween themed cloth mask, if you wanted to do that, might be more efficient.
And remember, the recommendation is 2 or more layers of breathable fabric, right, for a mask. So
right.
If that can be made as part of your Halloween costume, great.
Right.
Okay. So then some more moderate activities. Going to an open air one-way walk through haunted forest. So you're outside, you're going in one direction, where appropriate mask use is enforced, right? So folks should be wearing their masks and they're still remaining 6 feet apart. If screaming's going to occur, you're going to need more distance, right? So the greater the distance, the lower risk of spreading, obviously, the virus. So you want to, so just keep that in mind. And many places are very good about trying to follow all the CDC guidance on keeping things safe. So just look into, if you're thinking about doing an activity, look into their policies on how they're trying to follow CDC guidelines and see if you agree with them and see if they seem reasonable. Visiting pumpkin patches or orchards where people are using, say, hand sanitizer before touching the pumpkins or picking apples. Wearing masks, it should be, encouraged and enforced there. And the people are maintaining social distance. So obviously, if all that stuff is happening, a pumpkin patch or an orchard is a okay place to go with a moderate risk. Having an outdoor Halloween movie night, if you're lucky enough and you can shine a movie against a garage door, or if you're even luckier and have a movie screen, an outdoor movie screen, you could do an outdoor Halloween movie maintaining 6 feet distance, right? You have your chairs spaced out 6 feet. And I suggest wearing masks still also. If screaming is going to occur, though, remember you probably want to 10 feet or more spacing your kids, depending how scary the movie is, right? And lowering your risk by following the CDC's, right? The hosting. The CDC has come out with a lot of with many recommendations on how to deal with the holidays and hosting gatherings or cookouts, right? So outdoors is always going to be a much better bet than anything indoors.
And you can find those, I think, those recommendations on the CDC website.
That's correct.
Higher risk activities, obviously, is probably the traditional trick or treating where you go up to the house and you get the candy from the individual. Not totally recommended at this point, and neither is having the trunk or treats. Has become very popular in the last couple of years. But where cars are lined up in a parking lot and the child goes from car to car to car, not recommended at this point. Attending crowded costume parties held indoors. Going to an indoor haunted house, not recommend. It's higher risk. You're putting yourself at higher risk for doing these activities. But hay rides, tractor rides, we kind of touched on this before, that with people who are not in your household. So if you obviously have, I guess if you have 10 or more people in your home and you'd like to go on a hay ride, by all means, I guess go ahead.
If you have a farm and you have your own tractor,
also
go for it.
Go for it. And
some farms, if you look into it, like Cox Farms this year, they're doing drive-through. So you drive your own car through their hayfield. So that's an option. Obviously, you pay a fee for that. But there are options where you can stay in your car and you can drive through. There's some zoos that are doing that. The zoo out in Ruston was doing that, where you drive through your car through the and see the animals. So if you can, your car is one of the safest places to be in. So if you can be in your immediate family in your car, and do an activity, you're doing okay.
Very good. And obviously traveling to a rural area or a fall festival or things like that is not in your community. And if you live in an area with community spread of COVID-19, it's putting others at risk.
So the just a few things to remember. Some people might say, "Oh my gosh, I'm so frustrated. I'm so sad. We can't do Halloween." But look at this as a chance for you and your children to get creative. Be creative. You can still spend time together. You still do fun things. You're just gonna have to invent some new traditions. It's also a great opportunity to show your kids how to be flexible, right? And how to have a positive attitude and a positive spirit. If you're excited about it, make it fun. They're gonna have fun too.
Absolutely.
So most importantly, it's a good chance to teach them the importance, right, of protecting not just themselves but others, right? So they're doing their part by not going house to house, and they're protecting themselves and others. And there are definitely ways to find. There are ways that you can do safe activities during Halloween, and still have some fun. So that's kind of we wanted, obviously Halloween's coming right up around the corner, and we really wanted folks to just kind of have some positive thoughts about it, because it doesn't mean that it's a complete no-go, but there are definitely ways that have to be flexible and kind of
Modifying activities, yeah. And remembering that the decisions that we make on these days, these holidays, these things that we like to do as a community, they have a ripple effect beyond your own family. So, keeping in mind that these precautions are for a reason beyond yourself.
That's right. And so happy Halloween. And remember, flu vaccine, if your children haven't had it, we do have it in stock. And we are going to be doing a few more flu clinics, which have been great, where you can actually stay in your car, pull into a parking space in either of our offices, and the nurse will come to you. Again, your car is a great place to stay safe. So happy Halloween, and stay safe.